Speaker is Dr. Alan Herr from Albany Medical College, and he's going to be talking on GU interventions.
Well, this is going to be a huge change. It's not moving forward. Yeah, it's not moving on the mouse. Oh, there we go. Genitourinary interventions forms one of the pillars of interventional radiology, having been developed right alongside arterial interventions. In shortly more than 20 years, we went from an antegrade pyelogram for diagnosis purposes to being able to remove a stone percutaneously. And then 3 years later, the term endourology was put into being. I don't want you to think that during this time period we weren't doing interesting stuff. That's a picture of Eric Lang in 1959. He was getting ready to perform intravesical radiation therapy for a patient. During my practice lifetime, things haven't been quite as radical as this time period, but things have still moved forward. I've had a passion for genitourinary interventions since I began practice and have fortunately worked with some really good urologists over that time period. What I'm going to try to do in the next couple of minutes is talk about some things that you may be able to take back to your own practice and use in your own trenches. For lack of a better term, let's call them pearls. First one is use your urologist. Your urologist is certainly using you. Thank you for laughing. This is a young pregnant patient who's got a small stone, recurrent severe flank pain. One of my young partners at one of our outside hospitals gets ready to put a nephrostomy in, and no matter what he does, he cannot find a calyx. He knows the literature. He knows that he's got to get in through a calyx because later on the patient's going to have a percutaneous nephrolithotomy. He knows he's got to either be in that calyx or in the calyceal fornix to decrease the likelihood of the patient having a vascular injury. So he calls me frustrated and says, "What do I do?" I said, call your urologist, have him come to the suites, and have him put a ureteral catheter up from below. Needless to say, it didn't happen. Patient comes to me at the medical center, and what do? I have my urologist come to the suites, put a retrograde ureteral catheter up. This is an example, obviously, in a male, not a female. And, just so you know that it's been since the 1980s that urologists have been doing out-of-cysto suite endoscopy. So we may not see it regularly, but our urologists do it all the time. This patient came, retrograde ureteral catheter was placed, nephrostomy